Hi, this is Betty Long, founder and CEO of Guardian Nurses Healthcare Advocates. Welcome to Season 7 of the Lighting Your Way podcast, a season in which I continue to talk with my Guardian Nurses colleagues and hear from them about their day-to-day support of our patients and clients. Their stories are heart-wrenching, uplifting, empowering, frightening, captivating, and true. Welcome to Season 7. As you have heard in previous episodes, this season I am talking with my Guardian Nurses colleagues about their roles and about lessons that they'd like to share based on their support of their patients. In this episode, I talk with Paula Spector, Alicia Spataro, and Sarah Fisk, the mobile care coordinator team from one of our large clients in South Jersey. I hope you enjoy our conversation. Welcome to the Lighting Your Way podcast. I have a great team here this morning, Paula Spector, Sarah Fisk, and Alicia Spataro, all of whom are our mobile care coordinator nurses on our Coastal HIF client. Welcome, ladies.
Good morning.
Good morning.
Hello there. Welcome aboard, and I'm tickled to have all of you together. As I said before, it's great to have a team, and now to have a team of three is even better. So I wanted to get started just to introduce yourselves and tell us, a little bit about your nursing careers. Paula, why don't we start with you?
Hi, good morning. I'm Paula. I've been a nurse for about 20 years. I've worked in critical care most of the career. I do have some psych background, worked in the ER and did transports. Prior to becoming a nurse, I was a social worker for a while, but I've been with Guardian Nurses for about 2.5 years now, and I'm considered the acute nurse.
Great. And the acute nurse, and I know we'll talk about this a little bit, but the acute nurse in our programs deal with patients who are hospitalized, right, and have kind of acute issues. Sarah, how about you? Why don't you tell us about your career?
Thanks for having us, Betty. So I graduated nursing school from LaSalle in 2010. I worked 13 years at a community hospital and was primarily critical care. I have now been with Guardian Nurses for 1.5 years. I really can't believe time flies. And it has been a great time here. I work in the hybrid program. So that means I have acute patients along with chronic members also.
Okay, so Paul is especially focused on acute patients, and you kind of go either with acute or with complex with Alicia, depending on the volume.
Absolutely, yes. Depending on the volume and the diagnosis, we do break up our members into that acute program, and then the chronic program. You're able to provide a relationship with these members, and then just make sure that they have positive outcomes.
Mm. Yeah, which is a very difficult job these days in the healthcare system. All right, Alicia Spataro, let's hear from you, our complex kick. Good morning.
So I have been a nurse now for 24 years. I graduated in 2000, and I've worked most of my career in critical care at some of the bigger hospitals like Lady of Lourdes, and then transitioned to Community Hospital Jefferson and helped open a neuro unit that is now operating in the town that I live in, combined with Jefferson, Maine in Philadelphia. Mm-hmm. And then I took a little bit of a break there, and I did about 4 years in college health, which was very interesting and eye-opening. And that happened to be during COVID. So it was interesting to develop a program, how kids were going to go to college during COVID.
Wow.
And then now I've been with Guardian Nurses for 2.5 years, and I am the chronic nurse. So I deal with all the members that have chronic conditions, mostly diabetes is my specialty.
Okay. So we all know that there's an inordinate number of diagnoses that you have to deal with every day, right?
Yeah.
And I guess in as your experience as nurses, with all three of you coming from critical care, with all, Alicia, you're the senior member with 24 years. Paula, you're pulling up there. Well, no, actually, Sarah's. You're the youngster in the group. Um, what, like when you look at the diversity of patients that you have, because this is a fund with how many members? How many belly buttons?
16,000.
16,707.
Yikes. Okay. So Coastal HIF, and the HIF means Health Insurance Fund. Tell us, if you can, Paula, about the makeup of it. What does Coastal HIF mean in the South Jersey region?
Well, it's made up of employees and their dependents, and there is over 16,000 total. It's made up of a lot of school boards in the southern Jersey area, couple counties, and multiple city workers. And we take care of everyone's needs from the acute to the chronic.
And that's including their dependents, their children.
Correct. Yes.
So when you have that, I guess it's a diverse population. You have over 16,000. There's 3 of you. How does your day-to-day work? I know that we have a morning flow call, but do the 3 of you get together, Sarah, in the morning and just kind of tee up your day?
So yeah, in the morning we do have our notifications through our technology systems, which tell us what types of patients we have that day. Every day the schedule changes. It's really hard to define our day because we really work with our members acute and chronically. So usually Paula deals with the inpatient members, me and Paula, because we do work together on acute cases, go through the day, see what makes sense in terms of travel since we mobilize. And then based on those acute needs in the hospital, we're able to delve into these members' chronic conditions, and we are able to maneuver them into the complex program, which is where I take over in that role. Paula also determines if they're diabetic members. Alicia uses lab reports in the morning, along with other forms that can identify these chronic members. And Alicia really takes over that diabetic program that she specializes in and is able to also contribute time to these chronic members, which we identify in the hospital systems. So she really handles both diabetes as well as complex issues.
Yeah, and that's really, I think when we developed the mobile care program, it really was initially to meet people in the hospital and develop a relationship, like you said, Sarah, and then to be able to have them know who you are, to trust you, and then continue that relationship should they need it with either another nurse like Alicia, or in some funds we only have one nurse, and so that nurse becomes both, the Paula and Sarah of the world and the Alicia. But the transfer to you, Alicia, you're dealing with a lot of complex diagnoses, but mostly because diabetes is such a public health issue, you're dealing with a lot of diabetics. Is that right?
Yes, that's correct. We recently, in the last year and a half, developed a specialized diabetes program, and it's really taken off because a lot of our members do have diabetes. And in the complex world, most of the diabetic patients have multiple chronic conditions because of their diabetes, like cardiac issues, vascular issues, stroke, heart attack, amputations. So it's nice because I'm able to cover all those conditions and help them find specialists in the same health system to take care of all their chronic needs, not just their diabetes. But yes, we have a lot of diabetic members in our program.
Yeah. Paula, what you talked about the numbers, the 16,000, and it's school districts, it's municipal workers, it's certainly a diverse range of people, right, who all have different jobs, and maybe their jobs outside, maybe their jobs inside. Can you tell us about some of the patients that you've met in the hospital? Like, are they, you said municipal workers, but what are they doing? Are they desk jobs? Are they on the road jobs?
It varies. We have everyone from every position in a school, from a janitor to the teacher to the principal to, in the municipalities, there's judges and just prosecutors and correction officers. We have a little bit of everything in our fund.
What I think the challenge is sometimes when you have such a diversity of population is that, we often talk about meeting patients where they're at. And I know in one of the podcasts this season where Janine Fitzmaurice was actually driving to a hospital loading dock to meet one of her patients with the new Libre Freestyle that he had, or maybe it was the other one. Do you find that, Paula, there are, you have to adjust, I guess, your approach to different patients?
Definitely. With every mobilization, I meet someone at a different spot in their life and different education level, and I just try to figure out where they're at and what their needs are, and just provide the education and the resources that help them get to their healthy lifestyle again.
Is there one case, and I'd like to ask each of you about a case, but is there one case, Paula, that has been kind of stuck with you or that's really compelling and might provide a lesson for our listeners?
There's a lady that I recently met. I reached out to her. She was an ER discharge. I was just trying to see if she had any needs. She was seen a couple times. And I actually went to an accompaniment with her yesterday for a second opinion we expedited. But she started with ringing in her ears, and she wasn't real sure about what was going on. She didn't feel good. So she went to the ER. They referred her to an ENT. It turns out she had an enlarged thyroid. She had an ultrasound biopsy. It showed positive lymph nodes. She eventually had a thyroidectomy, and she was doing pretty good, but then she had another mass in her neck. So her current provider wanted to just kind of wait and see in a few months, repeat the ultrasound lab work, just kind of monitor. And she was uncomfortable with that. So after the initial connection, she felt comfortable enough just reaching out and asking for a second opinion, which I did expedite with the Center of Excellence for. And we went yesterday, and she was able to have some of her fears resolved, and we just have a new treatment plan, and we're working from there. But it's just nice to have the second opinions available and the education for people up front, that they know it's an option for them going forward.
And you don't know yet whether her treatment will change on that additional finding yet?
No, we have labs ordered and some repeat scans just to see where we're at and if both providers are heading in the same direction.
We talk about patients needing or wanting to get second opinions, and some of them don't even realize that it's a covered benefit. I think a lot of folks have the misunderstanding that an insurance company won't pay for a second opinion. But in fact, as we've said before, it can change sometimes it changes the diagnosis, and sometimes it changes the treatment plan. And I think the stats now are in 20 to 22% of the cases, something changes as a result of that second opinion. So I give you and your patient credit for getting that second opinion. It's usually worth it. It takes a little time, right? You got to take time off and you got to go, but it's tend to be worth it. Alicia, let's bring you back into the conversation. You're the complex care nurse. So is there a story that our listeners may find helpful when they're dealing with some of their complex or chronic issues?
Yes, I have a story that comes to mind where a second opinion can make a big difference. With the fund that we work with, a lot of our members like to stay within the local community hospital. And because it's convenient for them, they sometimes have transportation issues. Some of the members only have one car in their home. So there is some social issues sometimes that may prevent them from getting a second opinion. I have a diabetic member that was one of my first patients when I started 2.5 years ago. And he was a bus driver in the school system. And he started having issues with his circulation, even though we got his diabetes under control and his blood pressure under control. It's just that he had these issues so long term. They had been over 20 years that there was, chronic damage that was done, besides the fact that we were able to get it under control. So the member started with a sore on his foot. And you can imagine his livelihood, his work. He is a bus driver. He needs his feet. He needs to be able to drive a bus to, provide for his family and to continue his health insurance. So the local hospital, we were able to expedite an appointment to the vascular surgeon in his community hospital that he wanted to go to. And the very first recommendation by that provider was to immediately go for an above the knee amputation, which you can
Wow.
imagine was devastating to the patient. It was his right leg, the leg that he uses to drive his bus. So we were like, that is not an option. Seems very drastic. We just have to get a second opinion. It took me a while to talk the family into it. Like I said, they don't like to travel. They were very against going over the bridge, which is sometimes the barrier, but I was able to get them into a larger university health system within New Jersey. And we went with the vascular surgeon there, and he was able to just amputate half of the foot. And he was able to do a procedure that is a new procedure. And he was the first vascular surgeon to do it at this university hospital. The only other hospitals that had done this procedure were in California and another state. Wow. And the physician actually had to get approval and get all of the equipment brought into the hospital to do this procedure to save his leg and his foot. So he was able to wind up with just half of his foot amputated, which he can now still use his foot for driving and his leg. So it made a very big difference in his life and his livelihood to get a second opinion.
So how did I'm curious about the amputation of half the foot that he's still able to drive. What was the difference, and why did the surgeon feel like he could salvage the rest of the leg where the other surgeon decided?
Well, because he was more advanced and had more advanced procedures, the local community vascular surgeon didn't have access and experience. The surgeon came from Texas, where he had access to more advanced procedures, and he was able to do a sort of bypass with a artificial graft system that hasn't been used anywhere else, because the patient had chronic vascular issues. He was not a good candidate with his diabetes to have a traditional bypass. It probably wouldn't have healed well. And that was the issue with the other surgeon. He was feeling that he wouldn't be able to salvage enough and have it heal correctly. Because of the vascular issues and the blood flow issues. So the other doctor was able to encompass the procedure and save the leg and only take half the foot by increasing the circulation with the state-of-the-art procedure that wasn't offered at a community hospital.
Wow. That's a great, good. It's always good to live near an academic medical center, because to your point, they're always attracting the best and the brightest, and oftentimes have the all the new tricks and tools of the trade to do these cool, hopefully life-saving procedures. So he's still able to drive with half a foot.
Correct.
Okay. Wow. And I'm going to assume that he's paying a little more attention to his diabetes.
Yes, he is. And the funny part, well, it's not funny, but the crazy part is that we were able to get him under control, and he has his diabetes and his blood pressure very under control. It's just that it's been so long that he's had it. And when he was younger, he didn't take care of himself as well as he is now. So it's just kind of caught up with him, but he is doing very well with his diabetes.
Wow. Yeah. Diabetes is a brutal disease.
It is. It comes with a lot of other chronic comorbidities.
Yeah. So thank you for that. So second opinions, we are big fans of second opinions for sure.
Yes.
Sarah, how about you? You've been quiet, but let's bring you into the conversation. You're the hybrid, right? So you could do either an acute case or a complex case. So is there one case that resonates for you?
Yeah, that's correct. So quick story. I had met a member in the hospital. He was admitted because of diverticulitis and subsequently had an abscess develop. So he was in the hospital a few days. He had a surgical drain placed, and that surgical drain was actually sent home with him. Lucky him, he had to go home with the drain, but that was supposed to help with infection. It was going to drain that infection along with antibiotics that he was prescribed. he had been discharged, and I wanted to make a home visit because I did meet him in the hospital. He knew our role. He was accepting of assistance. So after discharge, I made a home visit. I talked about all of his discharge paperwork. I had assessed the drain while I was there. I have a background in clinical nursing. I was an ICU nurse, so I know. Okay, let me check out the patient. I had assessed his belly, and the drain was malfunctioned. It was loose, a stitch was hanging. It wasn't doing its job, and I just, if he did not get care now, he would be back in the hospital. And again, nobody wants to be in the hospital. So from his living room, we were able to get on the phone, call the provider, discuss what was going on, and he had an appointment early the next morning. I did go to that appointment the next morning with him. And at this point, he definitely trusts my decisions, my phone call to the provider, preventing him going to the ER, getting this appointment so that he could be looked at. We did get a CAT scan ordered, so we had the imaging in place, which we knew would be the next step. We discussed, the changes, what should we do at home with the provider. This doctor, he was good in, conversation, but he did not even view the patient's abdomen. So the patient left the appointment saying he didn't even look at my belly.
He came in. He didn't even look at.
So yes, he came into the room. He knew the patient from the hospital. He knew the drain was in place. There's an issue with the drain. Look at the drainage. What should he do? So he ordered a CAT scan. He didn't touch the abdomen, didn't look at the abdomen. And this set the patient off a little bit. He just felt like he wasn't a priority. But I again said, let me schedule this CAT scan. Let's see what we can do. Of course, outpatient scheduling. We try to schedule the CAT scan that's ordered. Because it's not ordered stat, it is 4 weeks away. Well, that's not gonna cut it.
Geez.
So
Yeah,
again, it's calling to the doctor's office, which I happily will do for this member. Called the doctor's office again, had it ordered stat, made calls to the hospital, spoke with the interventional radiology team. We were able to expedite that CAT scan again the next day. So this all happened in a 2-day span. I was very involved, very engaged. The family was relying on me. Again, not only the patient, but the wife also. I'm just stunned that we were able to make these connections, assist and expedite, and cared about the member. So we did get that CAT scan completed. And I just really want to fast forward to today, where you really need to, this patient learned that he really needed to trust his provider. So again, I'm going with the theme of second opinions, and fast forward to today, that was treated by a different provider, wound up having an uncomplicated surgery, and currently is doing amazing. He had a colostomy initially, which is reversed, and he is still continuing to follow up with the second provider.
Oh man. What? Wow. I have said in previous conversations that, I know a lot of people may take offense at this, but doctors are a dime a dozen, and you got to find the right one, right? And I think the joke we often say is, what do you call the one who graduates last in medical school? Doctor. So that is a harrowing story. I can't believe that surgeon never looked at the gentleman's belly.
And the surgeon could have been, a great surgeon, and I know they're busy, but it was just nice to find a provider that sat and talked and explained, rather than, I see this every day. All right, let's order this. And it was probably the right imaging, but at the same time, that priority factor wasn't there.
Well, right. And the personal touch wasn't there. And I know that some people will say, I don't care if a surgeon's warm and fuzzy. I just want him to be a good surgeon. But you'd also like him to be thorough. Wow. Sometimes I say you can't make this stuff up, really. So second opinions are clearly on the Coastal HIF team. They're the story of the day, right? Is there anything that, as I look at Paula and Sarah and Alicia, do you have any advice that you'd like to add besides please get a second opinion when you think about the group that you're working with? What would you like to say? Paula, how about you?
I think that if the members are just aware of the benefits that they have, they can be helpful just knowing about the services.
Sarah, how about you?
So for the members, I just want to make sure that they know it's okay to ask questions. And if you do need a guardian nurse there with you with a healthcare background, and can help to assist in asking those questions and getting you answers, then utilize guardian nurses, even if it's the providing support and being there to explain that new diagnosis. It's definitely helpful.
But what if somebody doesn't have a guardian nurse?
Again, you still can ask those questions. You can do your research, and you can have a family member come to an appointment with you. You can bring that pen and pencil. You can ask for your visit summary at the end of every appointment.
Alicia, how about you as we end? What would you like, besides getting a second opinion, again, because we've heard that, what other advice would you like to leave our listeners?
I would say for members to be more engaged in their healthcare plan, especially if they don't have a guardian nurse. It's nice if they have someone that they can bring with them, and during their medical appointments, to make sure that they get the best possible care. They need to be like an active member in their healthcare team. They need to know their medications, know what they're taking them for, know their medical history. Sounds crazy, but I go on a lot of appointments with patients and they don't even know why they're taking certain medications, and they've been on them for 20 years plus.
Wow.
And to ask a lot of questions. A lot of times they walk out of appointments and they don't even know what the doctor said. It's okay to ask questions to make sure that the doctor knows that you need to understand what he's telling you.
Right.
And it's not bothering the doctor to ask questions and have them explain things better. I just feel like follow-ups, make sure you follow up with your healthcare. If you don't understand instructions, call. Don't be afraid to be involved in your own healthcare, because you're your best advocate.
Yeah, I do appreciate that, and it's clearly the energy that the three of you bring to this is that you have to be more engaged. You have to ask questions. And if you have a guardian nurse, you got to have them come with you. But I do think that patients are intimidated, and that's what I hope that we're trying to do here on the podcast, is to give them some information, some education that they can actually do this on their own, right? Because you're not always going to be there. There will be appointments perhaps that you can't make, or someone in their family will not have a guardian nurse to go with them. So it's empowering for a patient to take that step and I don't want to say challenge, but have a conversation, right? Don't leave the room until you know where you're just told. And I've had that experience too as a patient. You walk out and you're like, oh my God, what did he just say? So, so ladies, thank you for contributing to this. And thanks for talking about the Coastal HIF, also known as the Coastal Health Insurance Fund. I think you guys are doing amazing work down there. So those members are lucky to have you. Thank you very much for taking some time to talk with me.
Thank you for having us, Betty.
Thank you.
You're welcome. All right. Have a good day.
You too.
You too.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.